Talofa lava, malo elele, kia orana, taloha ni, whakalofa lahi atu, nisam bulavanaka, kia ora, tēnā koutou katoa. Warm Pacific greetings and welcome to this exciting Pacific initiative. I'm Jo Chiplin, I'm the Group Manager for Primary and Community Wellbeing within the Mental Health and Addictions Directorate at the Ministry of Health. The Ministry of Health is inviting providers to submit proposals for the provision of primary mental health and addiction services for our Pacific communities. In this video, we want to briefly give you an overview of some of the key points from the RFP and to give you some hints and tips for putting together your best proposal. Please do read the full RFP document though, because it provides you everything you need to know for submitting your proposal, and this video is just a brief overview. So, some key points about this RFP. We are looking for proposals for primary mental health and addiction services. These are often the first point of contact that people will have with our mental health and addiction sector, and therefore it's important that services are easy to access, warm and welcoming. They're services for people who are experiencing mild to moderate distress. So that's people who don't meet the criteria for our secondary mental health and addiction services, but are still requiring some more formalised support. They need some extra support on top of that they can get from their friends and family. We're seeking proposals for comprehensive service models. And by that we mean services that offer a range of supports, including evidence-based talking therapies, assessments and treatments, as well as social supports, peer support, cultural support and self-management support. All of this needs to be underpinned by a Pacific framework and a Pacific model of service delivery. We provide a lot more detail about that in the RFP document, but in general what we're looking for is that services are based upon a holistic approach to mental health and wellbeing and include a Pacific worldview and Pacific values. This RFP is open to Pacific-led organisations. Those are organisations which are predominantly governed and managed by Pacific peoples, and organisations that provide services primarily but not exclusively to Pacific peoples. As I mentioned earlier, the expectation is that the development of these services will expand the continuum of supports, treatment and therapy available for Pacific peoples who are experiencing mild to moderate distress. The aim is to promote early detection and early intervention and to provide services in a culturally appropriate way. This RFP is targeted to specific parts of New Zealand, and we've specifically focused on the parts of New Zealand that have a high proportion of Pacific people within their populations. So not every part of New Zealand is included within this RFP. And if you look in the RFP document, you'll see the list of the specific areas that we're targeting this time round. It's important to remember that this is one part of a 5-year program to expand access to and choice of primary mental health and addiction services. The Ministry expects that there will be future opportunities to respond to other RFPs, both for general primary mental health and addiction services and for more services like this that are Pacific-led for our Pacific communities. So we're expecting that there will be future opportunities in the coming years. The RFP document, which you will already have, provides a lot more detail about the background to this initiative, what type of organisations are eligible, what your proposal should include, and the next steps. The closing date for this RFP is 31st of July 2020. I have invited Monique Faliafar, who has a wealth of experience within the Pacific mental health and addiction sector and in writing and evaluating RFP proposals such as this, to give us her thoughts on the secrets to pulling together a good proposal. So if you're new to these types of procurement processes, or unsure how to put your best proposal together, the next section is for you. Thank you.
Talofa lava, malola lei, kia orana, taloha nei, whakalofalahi atu, nisam bulivanaka, tēnā koutou katoa. My name is Monique Whaleawha and I've worked in Pacific mental health and wellbeing sectors for the last 20 years. And people ask me all the time, what is your advice on how to write good proposals? Now, I've been on both sides of the fence, either writing proposals myself to submit to funders or on behalf of the funder, reading lots of proposals and evaluating those. So I thought I would just take a few minutes to cover off 5 top tips for putting together a successful proposal. Tip number 1, start early. Give yourself the time to put together your best proposal. Believe me, you don't want to be rushing at the last minute. If you're intending on collaborating with other organisations, then get them involved in the process early. Starting early also allows you that really important thinking space. So by the time you have your first draft of your proposal, you still have plenty of time to make changes, to come up with diagrams and to make sure the whole proposal is nice and polished. And in case you didn't know, the GETS online tender platform has an automated electronic cut-off time. So if the RFP says to submit by 12 PM on a certain date and you try to submit after 12 PM on that date, the system just won't accept your proposal. So make sure you give yourself plenty of time just for that electronic submission process, particularly if you take into account running into IT problems. You'll save yourself a lot of stress if you just factor in time. Tip number 2, understand what the ministry are looking for. It's really important to take your time and analyse the RFP itself to make sure you've fully understood what the ministry is looking to purchase. For this RFP, the ministry is facilitating a briefing via Zoom, so attending that Zoom can also give you reassurance that you fully understand that what you're offering aligns with what the ministry is looking for. It's also a good time to reflect on your organisation's capabilities and make sure you're offering realistically matches capabilities at this point in time. It's also helpful if you know how the response will be evaluated, including the evaluation process, but in particular the weightings that will be applied to each of the sections of the RFP and the evaluation scale. Not only do the weightings indicate the relative importance of each aspect of the response, they also provide a clue as to where you should place your emphasis and energy when putting your proposal together. If there's any aspect of the services that you are unsure about, then you can ask questions via the GETS online tender system. And when you ask a question on GETS and the ministry answers, both the question and the answer is generally shared to all people who have registered interest in the RFP on GETS. So that way everyone has access to the same useful information. But in case that sounds daunting, don't worry, your questions are anonymous. And usually even the evaluation panel who assesses your proposal doesn't know who asked which questions either. Tip number 3, answer the question. When I'm on an evaluation panel, I love it when the information provided has absolute clarity. It responds to the actual question being asked and demonstrates the points being made with evidence. In fact, the evidence you provide to support your points you want to make can positively influence the scoring. So what do I mean by evidence? Evidence can include data, research with references, case studies to demonstrate your track record, or previous examples of tried and tested services, programs or systems that you've done in the past. And evidence can even include attaching people's CVs to the appendices of your proposal. Because it's important to be concise and with clarity, it can be helpful to include diagrams that sometimes illustrate or describe better than words. But if you do include diagrams, tables or pictures, remember, don't alter the Ministry of Health's template or form provided for your response. Tip number 4, know how the money works. Make sure you're aware of the actual funding available and the parameters of the Ministry's funding model. For instance, it's really good to know that in this RFP, the Ministry has full-time equivalent rates or FTE rates it will fund for particular jobs or role types, and this is inclusive of overhead. But if you want to know more on that, you can complete and send in the confidentiality deed provided, and the Ministry will share with you the funding available for your geographical area and the Ministry's FTE rates. And yes, one provider can propose to provide services in more than one geographical area. And make sure you complete the pricing template provided for this. And the last point on knowing how the money works, in addition to the price of the services that you'll provide, this RFP also requires proposals to include 2 years of recent audited financial statements to attach with your submission. Lastly, tip number 5, be compelling about your value add. You know what's amazing about your own work, and we want you to share that. I know it may not be a core cultural value for Pacifica people to self-promote and tell people how good you are, but this is not about modesty actually or humility. Now's the time to show that we're proud to be Pacifica and the value that you can add. So those are our top 5 tips for putting together a response to this request for proposal to provide primary mental health and addiction services for our Pacifica families and communities. That is tip number 1, start early. Tip number 2, understand what the Ministry of Health is looking for. Number 3, answer the question. Number 4, know how the money works. And number 5, be compelling about your value add. Really simple, but really effective. I hope that you've found the video useful. If you still have further questions, remember you can ask questions via the GETS online tender system. All the best and go well. Whaatai tele lava, malo au pito.